Hi, and welcome to Living Ground with Diabetes. I'm Cindy Redeman, and this is the first of a series of videos about diabetes. I'm here today with Dr. Wes Saade. He is going to be answering some of our questions about diabetes. How are you today, Doctor?
I'm doing great. Thank you for having me.
Good. Can we start with a little bit of, if you just tell us a little bit about yourself?
Yes, absolutely. My name is Wes Saade. I'm board certified in family medicine. I practice in Crowley, Texas, and I see all ages. I definitely see a lot of patients with diabetes. I did my training at the University of Texas Medical Branch and did my residency at John Lewis Smith Hospital in Fort Worth.
Right, thank you. In talking to other diabetics, they have expressed interest in answering some questions, and so that is why we're here today, is to see if you would be willing to answer some questions, which obviously you are. One of the questions that I've been asked is, how do I know how many carbs to eat at each meal?
Yes, absolutely. Well, first, Cindy, let me say I'm very excited that you have started this organization. I, just like you, I care about people with diabetes, and I think that what you're doing is, the first step is education, and this is what you're doing, so I'm very, very happy to be here.
Thank you.
One approach to approach carbs and diet is to go to a dietitian. That would be the ultimate approach, to go to a dietitian, and then based on your weight and medication, they will tell you exactly how much to eat. However, most diabetics know they either don't have the means or the time, or they don't want to go back. So what I tell diabetics is they're going to be eating 6 times a day, 3 meals and 3 snacks. Okay, so we're doing breakfast, lunch, and dinner, and then we're going to do snacks. 1 snack between breakfast and lunch, 1 snack between lunch and dinner, and 1 snack between dinner and bedtime. So there's going to be different carbs needs at each one. The easiest way to remember is we want to be around 200 grams of carbs for the whole day.
Oh, okay.
Now that will have to be changed because every diabetic is different, right? Our metabolism, but this would be a good starting point. Okay. So for breakfast, for lunch, and for dinner, aim to start with about 40 grams of carbs. Okay. Somewhere between 30 and 50 is good. Just start with 40. Okay. And then for the snacks, we want to be somewhere between 15 to 30 grams of carbs on the snacks. So if you add those up, they're going to be somewhere around 200 grams of carbs.
Okay. All right. Thank you. Doctor, how do I know what the right foods for me are to eat?
Right. Very good question. Just like our other question with how many carbs to eat, if you can afford seeing a dietitian, a registered dietitian, that's going to be the ultimate thing to do. However, the way you want to think of food is you have fiber, you have carbohydrates, which we talked about earlier, and you have fat, and you have protein. Okay. So what you want to focus on is to balance those 4. You want about 30% of your calories to come from carbs. So when you say what is the right food for me to eat, in diabetes we're mostly concerned about the carbs, the breads, the sweets, and things like that. However, to be healthy, you really have to have a good balanced nutrition.
Right.
You have to have your fiber, you have to have your protein, you have to have small amounts of fat, not much healthy fats like fish and things like that. When we talk about the right way to eat for a diabetic, okay, here's what I tell my diabetics. You want to eat a lot of vegetables, okay? You want to eat protein, lean meat, things like that. You do want to eat fruit, but the fruit has carbs, so you have to be careful there. Okay? And then you have to eat carbs in moderation. Okay? So a lot of what I said is theoretical. I mean, somebody may be watching and say, well, what is an example of a protein? And we can dig into more detail if you'd like. But that's the main concept. So as you look at your plate, you have to have a lot of vegetables,
Right.
some protein, a piece of meat, okay, the carbs needs to be about a quarter of that plate. Hopefully it's not a huge plate.
Right?
We're talking about moderate plate. So we're talking potato or rice or whatnot, just 1 or 2 servings. Okay? So that's kind of the general approach to thinking about eating.
Right. Okay. Well, thank you. And how can I help my loved one who has diabetes? That's been a really big question. And I know that it's hard for those who are their supporters or caretakers for people with diabetes.
Very good question. Thank you. So I think diabetes, there are 2 key words if we can encourage your listeners to remember. One is education, and number 2 is preparation. Okay? And if our loved ones can do that with us and support us, that's going to be the key. So starting with education, we've already talked about key issues with diabetes. We've got to understand, what is diabetes, what causes it, what are the risk factors, because that's going to motivate us to do a better job. But then how to eat, how to exercise, how to monitor the blood sugar. It's not easy.
Right.
Okay? So as a loved one of a diabetic, I would encourage you to be as educated about diabetes or more. Okay? And that's not a one-time class. That's something that we need to do all the time. So let's say if my spouse is a diabetic, ideally I should go to classes with her, I should pick up books, and I should always be educating myself and learning maybe new ways and new tricks. So I would say if you are leaving your loved ones be and say, hey, just eat better, that's not good, You really want to try to learn it with them.
Right.
Does that make sense?
That definitely makes sense.
Right.
Yes.
So the other one is the preparation. As you know, with diabetics, and I'm sure we'll talk on other videos, what's key is routine. Eating the same time, exercising at the same time if possible, and preparing what you're going to eat. Because if you find yourself hungry and there's nothing there healthy, you're going to probably eat something unhealthy. So preparation, if you can really conquer those 2, education and the preparation, you've got to prepare your schedule. You've got to make sure you have the support where if you need to exercise, that's got to be scheduled. Your food. So for our loved ones, if we can help them prepare, maybe even prepare things for them, that's going to set them up for success.
Okay.
So that's kind of a quick overview of how we can support education, which takes time, and preparation, which takes time. Yes.
Great. Thank you. I really appreciate you coming and taking time to answer these questions for us.
Yes.
It's going to be hopefully helpful, and in the future we hope to do some more videos and go into a little more depth on some of these issues.
It is my honor, Cindy, and for you diabetics out there, I want you to have hope. You can conquer this, and you can live grand with diabetes.
You can.
Yes.
You can. Thank you so much. I
You are
appreciate
so
you coming.
welcome. Thank you.
Thank you.